Yes, we are witnessing a surge in cases in many states. We are closely monitoring the situation. In the initial part of the pandemic, we had to establish everything from scratch, be it the surveillance, the laboratory capacity, the dedicated hospital infrastructure for COVID, the logistics of therapeutics and vaccine, and not to forget creation of the public movement for COVID-appropriate behavior. We have amply demonstrated that our policy of test, track, and treat effectively contains the transmission.
Right.
Now that the systems are in place with renewed focus on containment, mitigating the impact of COVID on high-risk populations, and re-emphasizing on COVID-appropriate behavior, we will be able to manage the second wave. Around 6 vaccines are in different stages of trial.
Right.
And will be granted permission as and when they complete all statutory requirements. Drug Controller General of India is looking in this matter, as already emphasized. This is a dynamic process.
Okay, so it'll evolve as we go along. I just wanted to ask you, Dr. Harshvardhan, you're obviously not somebody who believes actually cover everyone, or is it just completely an irrational sort of exercise which one can never hope to complete?
Rahul, the history of this coronavirus is unknown. The disease COVID-19 is very dynamic in its behavior. So from day one, we are only relying on the evolving scientific evidence to drive our decision making to mitigate the impact of the pandemic.
Yeah.
Our containment strategies to check the spread of the virus that have been praised the world over were based on such scientific inputs.
Sure.
We are carrying out genome sequencing of the virus to keep a track of any changes in its propensity or nature. The vaccination drive is being conducted in accordance with emerging science-based data analyzed through scientific algorithms, which also suggests that if a majority of our population, including the targeted priority groups, are immunized against COVID-19, we shall be able to get a control over the disease. Even if you have enough people vaccinated, these actually give enough protection in the population to prevent the virus from actually going from one person to the next. So it's really like having a barrier of people who are protected, who break that chain of transmission.
Right.
So you don't need every single person in the area, in the population, to necessarily be protected. This is like achieving herd immunity through vaccination. We are monitoring the emerging surge in cases very closely. As of now, there is no evidence that there is a shift to younger age group as far as severity of the disease is concerned.